Good afternoon. My name is Mary Nettles, and I'm here today to speak with you about the initiative of correct coding and the accuracy of your charge master and how that ensures accurate payments received from the Medicare government billing system. There are several items that we're going to go over today. The first part of this discussion is going to be over the um, elements of your charge master that ensure that you have correct coding and will ensure that you are receiving accurate payments. The first and most important element of your CDM is your HCPCS or CPT code. There are two different levels of HCPCS coding. The first level is called CPT codes. That's a five-number numeric number that classifies the procedure you're performing in a standardized fashion so that Medicare can ensure accurate and consistent payment for the same procedure to all providers. The second level of HCPCS coding is a HCPCS level 2. The HCPCS level 2 is an alphanumeric code. These codes are typically used for pharmaceutical items, supplies, and any new technologies. Medicare typically uses these codes to track revenues and track costs of providing new technology services to later allow a CPT code and standardized payment for these services as well. The second most crucial element of your CDM would be your revenue code. Typically on um, inpatient claims, the revenue code is what drives your payment rather than your CPT or HCPCS code. CPT and HCPCS codes are typically used on your outpatient coding claims. Inpatient codes, Inpatient claims with revenue codes use the revenue code to classify the revenue as to where the service is being provided and where the cost is incurred. This is a three-digit numeric code that Medicare will use in order to determine the amount of payment and classification that they classify the hospital stay in order to give you a tier payment based on the criticality of the patient and their inpatient stay. One of the other elements within the CDM is a modifier. A modifier can be added to your HCPCS or CPT code. This will allow greater specificity and give Medicare needed information to determine if an additional payment is warranted. Some common modifiers that could be used are an RT, specifying that it was performed on the right side of your body, especially if this is a paired organ, or a paired limb, such as your right arm versus your left arm. You can also use a modifier 59. This is the most commonly used to override payer edits in order to notate that this is a separately identifiable service and should be paid and considered for additional payment from Medicare. Another element within your CDM will be your price. This price is determined by your institution and can be arrived at by many different ways. Depending on your organization, some organizations will use market data in order to obtain a standard pricing process. Other facilities will use your Medicare APC payment in order to determine what Medicare would pay for the procedure and apply a markup to that to determine what their cost should be and how it should be represented to your payers. Since not all payers use the Medicare APC payment schedule, your payment will vary depending on the payer and their payment process. Some of the other data elements would be a charge code. Each facility, each entity has its own method of numbering its procedures. So this could be have a numerical significance, such as the first three digits may represent a department or service area, or it may be a completely random number and just numbered in sequential order as to when the charge item was added to your CDM. Another data element would be a charge description. This is typically used within your healthcare system so that the people utilizing the charge master know what the service is for. However, that description typically does not go on your claims to Medicare or your other payers, but rather the description of the CPT code or the revenue code that has been assigned. However, the description can be used to notate greater specificity in your charge, so as an end user, you would know better what that procedure was being used for. There are many governing documents that determine how you establish your charges within the CDM. Some of those items would be your correct coding initiative. So Medicare has published a document that says what CPT codes can and cannot be reported together. Services that they determine are inclusive of other services and should never be billed together. This document can be found out on the CMS website. It will tell you if the two codes are dependent upon each other and should never be reported together, which means if you do them together and use them and perform the same procedures on each patient, then only one of those charges can be reported. However, there are some that say they sometimes could be done together. In order to get around one of these edits, if they are two uniquely identifiable procedures, you would simply add a modifier 59 to the claim, and then both CPT codes, both procedures would be considered for payment. One of the other edits that Medicare has in place is a medically unlikely edit. This is an edit that dictates the number of units that can be billed for a certain CPT code. So that might say you can only do 2 of these per date of service. If you do more than that, then that is not going to be covered by Medicare. But they have reviewed these procedures and determined medically how many times that procedure can be performed on a patient. Some of the other governing documents, you do have local coverage determinations. These are written by your local FI, your physical intermediary, and tells you what services they will cover and not cover whenever they are paying claims on behalf of Medicare. There are also national coverage determinations that cover all states and all entities, whether you be a SNF provider, an acute care hospital, a psychiatric provider. But these national coverage determinations are sent out from Medicare to the FIs, and the FIs are to enforce them for their the entities that they pay claims for within their states. So as you can see, there are many documents, many governing bodies, many ways that the charge masters can be monitored and regulated to ensure that you're being reimbursed appropriately for the services you are providing to your patients. Thank you.